Welcome back, everyone. Today, we're discussing a fascinating and somewhat surprising topic: how vitamin D, often associated with strengthening bones, might actually lead to bone loss in certain circumstances. We'll break down how this happens, what vitamin D does for the body, and what you can do to keep your bones healthy. Vitamin D is essential for many bodily processes, especially for our bones. It helps us absorb calcium, which builds strong bones. However, just like with any nutrient, too much or too little vitamin D can disrupt this process and potentially cause problems. So, today, we're looking at both sides of the coin. Let's start by understanding what vitamin D is and how our bodies use it. Vitamin D is produced when our skin is exposed to sunlight, and it's also found in foods like fatty fish, egg yolks, and fortified milk. However, because most people don't get enough sun or dietary vitamin D, many turn to supplements. Once vitamin D enters our bodies, it has to be converted to its active form. This conversion happens in two stages: first in the liver, where it becomes 25-hydroxyvitamin D, and then in the kidneys, where it becomes 1,25-dihydroxyvitamin D, also called calcitriol. This active form is what helps regulate calcium levels. So, how does vitamin D help bones specifically? Calcitriol increases calcium absorption in the small intestine, helping us retain more calcium from the foods we eat. Since our bones are the primary storage site for calcium, they rely on this balance for density and strength. Vitamin D also interacts with receptors on bone cells, especially osteoblasts, which build bone, and osteoclasts, which break down bone. When functioning correctly, this process helps bones remodel and renew. However, as we'll discuss, too much vitamin D can sometimes disrupt this balance. While it's common to hear about vitamin D deficiency, excessive vitamin D can actually harm bones. This condition, called hypervitaminosis D, is usually caused by taking high doses of supplements over a long time. With too much vitamin D, calcium absorption can increase to dangerous levels, causing hypercalcemia, or high blood calcium. When there's too much calcium in the blood, it starts depositing in soft tissues rather than staying in the bones. This can weaken bones over time and lead to calcification in organs like the kidneys. Hypercalcemia can also prompt the body to reduce bone density as a way to lower blood calcium, ultimately causing bone loss. Our bodies have a backup system for low calcium called parathyroid hormone or PTH. When blood calcium drops, PTH signals bones to release calcium. But if you're overloading on vitamin D, it can override this natural PTH balance, prompting calcium release from bones even if blood calcium is already high, weakening bones further. A balanced intake of calcium and vitamin D is essential for healthy bones because these nutrients work together to support bone density and strength. Vitamin D plays a crucial role in helping the body absorb calcium from food sources. Without enough calcium in the bloodstream, even with high levels of vitamin D, the body may start to leach calcium from bones to meet its needs, weakening the bones and increasing the risk of fractures and osteoporosis. Here's why the balance is so important. Calcium is a major building block of bones, making up about 70% of bone structure. For strong, dense bones, the body requires a steady intake of calcium. If calcium intake is insufficient, the body pulls calcium from the bones, leaving them more porous and brittle over time. Vitamin D assists in the absorption of calcium from the intestines into the bloodstream. However, if vitamin D levels are excessively high without adequate calcium intake, it can disrupt the body's calcium balance. High levels of vitamin D may increase calcium uptake but can also lead to calcium imbalances elsewhere in the body, potentially depositing calcium in soft tissues instead of bones. When vitamin D is high and calcium is low, it can contribute to hypercalcemia, too much calcium in the blood, which can weaken bones, affect kidney health, and cause abnormal heart rhythms. This imbalance might occur when individuals supplement with high doses of vitamin D without corresponding calcium, especially if dietary calcium intake is low. To maintain healthy bones, experts recommend getting both nutrients in balanced amounts. For many people, this means consuming calcium-rich foods, like leafy greens, dairy products, or fortified alternatives, while getting adequate, but not excessive, vitamin D from sun exposure, food sources, or carefully monitored supplements. Other nutrients like magnesium and vitamin K also play a role in calcium metabolism and should be part of a balanced diet for optimal bone health. Magnesium helps regulate calcium transport, while vitamin K aids in binding calcium to the bone matrix, enhancing overall bone density. Understanding this balance is key for people at risk of bone density issues or those already supplementing with vitamin D. A well-rounded diet combined with adequate sun exposure or properly dosed vitamin D supplements can help support both bone strength and overall mineral balance in the body. Chronic kidney disease, or CKD, impacts vitamin D metabolism significantly. The kidneys are responsible for converting vitamin D to its active form. With CKD, patients often have trouble with this conversion, which can lead to abnormal levels of both vitamin D and calcium, resulting in weaker bones and conditions like renal osteodystrophy. Some autoimmune diseases, like sarcoidosis, can cause the body to produce too much active vitamin D, which increases calcium levels. Without proper regulation, this can lead to bone resorption, where calcium is pulled from the bones to correct blood levels, ultimately leading to a reduction in bone density. As we age, bones naturally lose density. Vitamin D needs change, too. Older adults sometimes need more vitamin D for immunity and calcium regulation but can be more susceptible to hypervitaminosis due to slower metabolic clearance. This age-related shift means careful monitoring of vitamin D intake is essential for bone health in older age. The recommended daily intake for vitamin D varies, with adults generally needing 600 to 800 IU daily. However, supplementation above 4,000 IU per day without medical supervision is discouraged to avoid hypervitaminosis. Ideal sources include sunlight, food sources like salmon, fortified cereals, and moderate supplementation if needed. Remember, vitamin D and calcium work best as a team. A well-balanced intake of calcium-rich foods, like dairy products, leafy greens, and certain fish, can help maintain strong bones alongside vitamin D. Adults generally need around 1,000 to 1,200 milligrams of calcium daily. To avoid complications, regular blood tests are a good practice, especially if you're supplementing with vitamin D. Look for both vitamin D and calcium levels to ensure they're within a healthy range, and ask your healthcare provider to monitor if you have a condition that affects calcium regulation. To maintain strong bones and prevent bone-related issues like osteoporosis, specific lifestyle habits play a significant role. Weight-bearing activities like walking, jogging, hiking, and dancing encourage bone formation by stimulating bone cells, which helps maintain bone density. Resistance training, including lightweight lifting or bodyweight exercises like squats and lunges, also plays an essential role in strengthening bones. These exercises cause muscles to pull on the bones, which stimulates bone growth and helps slow age-related bone loss. Avoiding alcohol consumption is important because consuming high amounts of alcohol interferes with the body's calcium absorption, reduces bone density, and increases the risk of fractures. Excessive drinking is associated with weakened bone structure and can also lead to falls, which may result in fractures. A balanced diet is fundamental to bone health, with nutrients like calcium, vitamin D, magnesium, and vitamin K being particularly beneficial. Calcium is essential for bone structure, while vitamin D aids calcium absorption. Magnesium and vitamin K support calcium's integration into bones. Incorporate leafy greens, fortified foods, nuts, seeds, and lean protein sources, which are excellent nutrient sources for bone health. Avoiding smoking is crucial as it weakens bones by reducing blood flow, calcium absorption, and the production of bone-forming cells. Nicotine and other chemicals in cigarettes interfere with hormone production, particularly estrogen, which is crucial for bone health. Studies show that smokers are at a higher risk of fractures and experience slower healing after fractures. Quitting smoking significantly reduces these risks, even if bone damage has already begun. Adequate sleep supports various bodily processes, including those related to bone remodeling and repair. Sleep is also vital for hormone balance, as hormones like cortisol, which can increase with poor sleep, impact bone density negatively. Research suggests that individuals who get 7 to 9 hours of sleep each night have better bone health than those who get fewer hours or have sleep disturbances. Safe sun exposure helps the body produce vitamin D, which is essential for calcium absorption. A daily 15 to 30 minutes of sunlight, depending on skin type, time of day, and location, helps maintain optimal vitamin D levels naturally. During seasons with less sunlight, vitamin D-rich foods or supplements may be necessary to support bone health. Maintaining a healthy body weight is important because both low and excessive body weight can negatively affect bone health. Low body weight, especially if due to restrictive eating, can lead to bone loss, while excessive weight puts stress on bones, which can lead to fractures and joint issues. Maintaining a balanced diet and regular exercise routine is ideal for supporting healthy body weight and bone density. If you're considering supplements, remember that more isn't always better. Start low, follow medical advice, and increase cautiously if needed. Vitamin D supplements can be beneficial, but it's important to balance them with your overall diet and lifestyle to avoid potential downsides. While vitamin D is essential for bone health, excessive amounts or imbalance with calcium can lead to bone loss. By maintaining balanced intake, monitoring blood levels, and incorporating healthy lifestyle practices, you can ensure your bones stay strong. Before making any significant changes, talk with your healthcare provider to determine your unique needs. Vitamin D is powerful and beneficial, but like any nutrient, it requires careful management. Thank you for joining us today. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more content. Let us know in the comments if you have any questions, and take care of your health.